So I just want to kind of give some context to, people who will be listening or reading, this interview, via our blog site or socials. We're here with Dr. Ricardo Tan from California Allergy and Asthma Medical Group. So thank you again for taking some time out of your day. He offers, 20 years of experience as a nationally and internationally recognized practitioner. I believe you completed your fellowship in allergy and clinical immunology at UCLA's Medical Center, even being named a Southern California super doctor by Los Angeles Magazine in the field of allergy, which is amazing. Your list of accomplishments is quite impressive, and I could probably keep going, but I'd love to hear from you. Kind of what inspired you to become a medical doctor and why specialize in allergy and immunology?
Thank you, Lex, for having me. I've always been interested in science growing up, and I always felt that going into medicine would help me pursue that interest, as well as have a career that involved helping people. I decided on allergy and immunology while I was doing my internal medicine residency. Um, Allergy is such a fascinating field. It includes everything from the respiratory system to the skin. And I don't have to tell you that immunology in the last 20 years has also kind of exploded, so that almost all conditions now we're finding has immunologic basis. So for me, it's very fulfilling, as well as still a very fascinating field for me.
Nice. Awesome. Thank you. So kind of turning the page a little bit, and kind of implementing, digital health solutions into practices to, improve health, by driving patient adherence, self-management, and cutting costs. What made you kind of adopt those digital health solutions into your practice, and, what patient demographics, in your opinion, are best suited for those?
I think, now in this day and age, considering how much of our home life and personal life involves digital solutions, it's really something that the medical field maybe has been slow to adopt, especially doctors, actually, to be honest. We're so used to doing things the old way with paper and in-person visits, but I think that's not the way of the future. It's important to be where our patients are, which is, doing most of their personal activities and career activities through digital means. So there's no reason why they shouldn't take care of their medical health the same way.
I'm not sure if we lost him there.
Oh, can you hear me?
There we go.
Yeah, we can hear you.
Oh.
Awesome. And then
should I repeat my answer?
No, you're okay. Thank you.
Okay.
And in your opinion, what patient demographics are best suited for those solutions?
So the ones that will adopt it quickly, I found, are younger patients. They're the ones that have the least resistance. Older patients, above 65 may have some challenges, but I really think there's no limit. Everybody, medically speaking, all demographics that have respiratory issues, should be the target for any RPM.
Yeah, absolutely. And I know California Allergy and Asthma is dedicated to, providing the latest and most up-to-date, diagnostics and, treatment options in allergy and asthma care. So what advice would you offer a physician that also wants to start, implementing digital health solutions into their practice?
I I would advise any physician who's looking into it to give it at least a try. I think most physicians nowadays are very busy with administrative stuff, and they may not want to take that leap, and they may think it's too complicated. But I really urge them to give it a try, to look at the system, have their staff involved, give it a try, see how the patients like it, and I really think they won't regret the time they spend on it. It's not as hard as it looks to implement, and the benefits are enormous, I think.
Yeah, absolutely. And, last but not least here, in your opinion, how do you think, RPM and, the utilization of digital health solutions will evolve, specifically respiratory healthcare over the next 5 years?
I believe that over the next 5 years, more and more physicians, not just in allergy, will appreciate the benefits of having reliable, accurate spirometry readings available to them at all times, especially when the patients are at home. Over the years, we've relied only on in-person spirometry. Previous devices were not too reliable. But now that we have this, and we can really use this objective tool, I think that as more and more physicians realize the benefits for their patients, for better control, for better targeted treatment, that the adoption of this in the next 5 years will really increase.
Thank you. I'd also, love to open up the conversation to Sharvi and Jason as well, if you guys wouldn't mind.
Yes, sure. Thank you, Lex, and thank you, Dr. Tan, for those answers. What always intrigues me is when we're talking to potential doctors about using RPM. We always talk about what are the outcomes, like what are doctors kind of looking for, over time. Would you be able to share with me how Aluna or how RPM over time has helped improve your patient outcomes and giving your patients maybe more control of their disease?
Yes. So, as you know, based on the NIH asthma guidelines, we monitor several factors to give us an idea of the patient's severity and control. And the major factors are the patient's symptoms, of course, their use of medication, and objective pulmonary measurements like spirometry. If we only rely on the symptoms and what the patients tell us in terms of how often they're using the rescue medications, for example, we're missing like a huge part of the patient's true status. So if we have all that, the outcomes improve, and that includes less hospital visits, less unplanned visits, less use of medications, including steroids and antibiotics, and in general, just keeping the patient healthy. Sorry, let me just, okay.
No problem. Thank you for that. And I know you'd share with us a little bit about how you would, where you think RPM and digital spirometry will kind of be 5 years from now. If you were to think about, how it will evolve, kind of your level of care for your patients, how would you think about using Aluna with, potential virtual care? How are you able to treat more patients using this device than maybe you'd be able to treat them in person with the, COVID and, restrictions that, some patients are maybe comfortable doing in office spirometry?
Yes, it definitely helps if they can send us their Aluna readings. I can review it while I'm looking at them, while I'm seeing how they breathe on the video. And that really makes a big difference for doctors, because even in person, the patient's appearance or physical exam may not necessarily correlate directly with their spirometry, but the spirometry is very important, you know.
Excellent. Well, thank you. I think those are my two main questions. I don't know, Charvi, if you had any questions top of mind.
No, and then, I mean, can you tell us more about like how it specifically potentially like, helped some of your patients?
So I have a patient, for example, who was coming in almost every month with exacerbation of their asthma. She would, any change in her exertion or any cold would make her have a bad exacerbation. I was ending up giving her prednisone almost every other month. And every time I saw her in person, she would swear that in between she was fine, and then she would just suddenly get worse 3 days later. Within 3 days, she would be having a bad exacerbation. Once we started doing the Aluna, I could see that in between her FEV1 was actually never really completely controlled, despite all the medications I was giving her. So she was always on the edge. It didn't take much for her to have a bad exacerbation. So as soon as I found that, I started her on a biologic. We were able to track her progress again with Aluna. And now, she hasn't been back with an exacerbation, for the last 6 months or so.
Wow, that's really great to hear.
Yeah.
Yeah, that's all of my questions. Do you have anything else, Lex, Jason?
Yeah, I don't know, maybe if there was anything else you'd love us to know more about your practice, just about yourself, your experience with RPM, just maybe we can open up the floor to you, Dr. Tan, to, highlight things about yourself and the practice, that we would be happy to share as well.
So I've been in practice for about 20 years. I think we see all kinds of patients. One thing since you're the marketing part, I think one hesitation from a lot of doctors is how much work there will be in the billing, and if they'll kind of compensate them adequately for their time. And I can tell them that it does. I only have like one dedicated person doing it and kind of keeping track of how often I talk to the patient. And all the instructions that Charvi gave me before, it all works. It just makes a little push for the doctor to do it, or one person in the office to kind of be in charge of it, and it's really worth it. So I think some doctors, even if they don't say it, that's their hesitation, is how much work it'll involve.
Awesome. No, that's helpful to know. And over the past couple months since I've joined in the team, we've actually hired a billing manager, right? So she's responsible for partnering with, for example, for you, Sharon, who is an office manager who helps with billing. She will verify patients' insurances. So if you had a list of a couple patients that you were curious whether or not Aluna would make sense, you'd be able to send their information. We use our system to verify their insurance, find out if they have a copay, if they have a deductible, what their financial responsibility would be. And then we pass that information over to you. And then we also are able to help assist with claims and help, in terms of like, just making sure everything is kind of smooth sailing for you. We also have added a registered respiratory therapist who onboards patients, coaches them technique, engages with them, and is just another level of support. So these are all new perks that we are now offering with Aluna to, as you mentioned, just kind of get started, but there's a lot of work we can do to take that work off of your plate as a physician, take the billing work off of the plate of maybe a billing manager, and kind of partner with Aluna to help out there. So it was definitely, wanted to share that with you.